Next up is Latina skin, which is a little lighter and usually more olive in tone, sort of a medium skin color. Let's look under the skin here to see what's going on. There's a little bit less melanin, those melanocytes that make the cells, a little fewer of those. That lets the sun get through there more. And so these folks will have more sun damage, but you still get some of the hollowing out. You still get, especially around the eyes, as the skin starts to drop. Because remember, it still has the collagen beneath it, but it's more prone to some of the sun damage. Dermatologist Dr. Alicia Barba is joining us. She has got a skincare routine for olive skin. Welcome to the show.
Thank you very much.
So I actually think I probably have. You do too.
I think so.
It's about the same color.
Yeah.
So what's the most important thing for folks who have an olive skin tone to keep in mind about their skin protection?
Well, people with olive skin type, our skin type, we actually have the ability to tan, and oftentimes to tan quite beautifully, which is nature's way of protecting us against skin cancer and sun damage. However, skin that can tan also can pigment quite horribly. And this is one of the skin conditions that I'm oftentimes treating in Miami, a very sunny climate, is hyperpigmentation.
So let's talk about cleansing for olive skin types. Is there a particular routine that might differ from other types of skin?
Yes, well, instead of actually choosing a cleanser based on skin color, I like to choose a cleanser based on skin condition or the skin type that one has. So one of the tricks that I often use in my practice is using a gentle skin cleanser in the morning and something more foaming at night. And the reason for that is that oftentimes we can tend to over-exfoliate. So really using something gentle in the morning to really get off a little bit of sebum and some of the products that we have applied to the skin at night is sufficient enough. And at nighttime, using a more foaming cleanser, something to really get that makeup and sunscreen off of the face. 2 passes is recommended if we're wearing a full face of makeup. And I often use a cleanser to even take off my eye makeup. It's sufficient for me. And I always tell my patients, going to bed with a full face of makeup is like begging for a pimple the next day.
Yes, very well stated. All right, let's talk about the morning routine.
So the morning routine after cleansing the face, I recommend an antioxidant, a vitamin C serum that is stable and that has been proven to penetrate the skin. And this is important because one of the things that we have to remember is that sunscreen is just that, just a little screen. It is not a sunblock. So we're always getting penetration of some of the sun rays through sunscreen. Oftentimes we feel that we're 100% protected when we're wearing sunblock or sunscreen, and that is not correct. In fact, we are no longer going to be able to use the word sunblock. That's one of the FDA guidelines. We're going to have to, yes, and the manufacturers are actually going to have to use the word sunscreen so that we don't feel that false sense of security when we're wearing sunscreen. So because some rays do penetrate the sunscreen, having an antioxidant underneath will help to quench some of those free radicals that get released when we're out in the sun.
Okay, and then during the day, of course, you go out and you get some exposure to the sun, you put your makeup on, all those other fun things, and then in the evening, what's your care routine going to look like?
And so because pigment is really important, one of the concerns in my skin type, using a skin lightening agent at nighttime is recommended. And oftentimes the same agents that actually help to lighten the skin and to beautify the skin are actually the same agents that also help to fight aging. And one of the ingredients that you actually want to look for is retinol.
Retinol.
That's correct.
Thank you very much.
Thank you.
All right, and finally, the fairest skin type. This is a typical Caucasian complexion. Now, if you look on